and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. We'll begin with the agenda for the Douglas County Board of Equalization. Roll call, please.
Commissioner Maureen Boyle.
Here.
Commissioner Mike Boyle is absent. Commissioner Kavanaugh.
Here.
Commissioner Friend.
Here.
Commissioner Morgan.
Here.
Commissioner Rogers is absent, but Chris Rogers is attending via virtually. And Madam Chair.
Present. Item A, approval of the minutes of the Board of Equalization meeting held Tuesday, July 20th, 2021, and B, call for a meeting and set Tuesday, August 3rd, 2021, as a date for hearing on certified assessment corrections reflecting the addition of omitted property to the tax rolls or increased value on property. Is there a motion to approve A and B?
So moved. Second.
Motion by Commissioner Morgan, seconded by Commissioner Friend. Any questions or comments? Please.
Just have a quick comment. We have received from the clerk kind of an overview, including backup information. This information the clerk compiled for us is extremely helpful in getting a grasp on where we are on Board of Equalization, and historically it has a look back on it as well, and geographically it has a breakout, numerous breakouts, so that you can drill down to the actual homeowner if you want, but by zip code or areas of the city. So I just wanted to thank the clerk for that, and it's updated on a regular basis, and believe me, I'm using it a lot. Thanks.
Thank you.
Citizen comments. Is there anyone wishing to?
Madam Chair, I'm sorry, we actually hadn't voted yet on the last item.
Oh, sorry about that.
Motion passes 5-0.
Citizen comments. Is there anyone in the chamber wishing to speak to the Board of Equalization about an item not on the agenda? Seeing none, we have one resolution, item D, approving applications for tax exemption form 457 on motor vehicles recommended for approval by the county treasurer. Is there a motion to approve the resolution D and adjourn? Is there a second?
Second.
Motion by Commissioner Maureen Boyle, seconded by Commissioner Morgan. Any questions or comments? Please vote.
Madam Chairman, let me ask one question.
Motion passes 5-0.
Dan, I was going to ask you, I think the citizens will be getting notice of their results from the assessor's office of what the outcome was concerning what their appointment plea was at the Board of Equalization.
Dan Esch, Douglas County Clerk. So August 10th is when the referee recommendations will come before the board. People who have protested should be aware that that's the date that the recommendations will come before you, and then once those are voted on, we have a week to mail out notices to both the homeowner or property owner, and then if the protester was different than the property owner, then to the protester as well.
So they would likely get those around the 20th of August, possibly?
If I would, so we have, by statute, we have to mail them by August 18th. I would expect we'd have them all, I mean, knock on wood, right? But I would expect we'll have them all mailed out by Friday, August 13th.
Okay, and I think if they look on the assessor's site, I think they'll see that recommendation sooner.
Correct. So if you go to boardofelqualization.org, we post, it's just a spreadsheet of all the recommendations, and it'll be searchable, so you can look by your address or by your owner name or parcel number, whatever identifier you have, and it'll let you know prior to that August 10th meeting what recommendation is coming before this board.
Okay, and then, Madam Chairman, do we have a date yet of when the Board of Equalization, like we did last year, when would that be?
August 10th. August 10th, those recommendations will be before the Board of Equalization.
Oh, okay, so that'll
Yeah.
be actually before they're mailed out?
We have to approve them, and then they're mailed out.
Right, but last year when we listened to some citizens come before us, in the room up on the third floor. I'm just wondering what that date is, that approximately, when we sat there as a board and people told us what happened, that last year, whatever might have happened at that point, they got their taxes reduced, they were raised back up. This year, we had some of those.
Again, August 10th will be that date that anybody can come before the board, but we normally don't. I mean, once the referees, it's always been kind of the process that we have chosen the referee process. And so once the referees provide their recommendation and it comes to the board, we then approve those recommendations.
Right.
And that will be August 10th.
Yeah, Commissioner Morgan, I think what maybe your question is, how do these folks know to show up on August 10th? We don't mail them a notice, but there are things posted on the website and all sorts of things. Well, I'll take that back. When we mail them the initial value change, we kind of, on the backside, we give them a general timeline of what to expect, and we do say that August 10th is when the board will take action on the referee recommendations. Sorry, go ahead, Commissioner
Well,
Morrison.
I'm going to cut off the discussion because this isn't on the agenda, but what I will do is work with Catherine Hall and have her put something on our website about the dates that you all just talked about, so that there's something out there for folks to know, and then send out a media press release on it
And
as
for Mike
well.
and Maureen, that meeting wasn't in this chamber.
Right, it was in
up on the
903.
third floor.
Right,
Yep, okay, thank you,
Mhm.
sorry.
that's okay. We'll move on to the agenda for the Douglas County Board of Commissioners. Roll call, please.
Commissioner Maureen Boyle? Here. Commissioner Mike Boyle is absent. Commissioner Kavanaugh? Commissioner Friend?
Here.
Commissioner Morgan? Commissioner Chris Rogers is present virtually but cannot act as a commissioner, and Madam Chair.
Present. Item A, approval of the minutes of the Board of Commissioners meeting held Tuesday, July 20th, 2021, and please note the other minutes available. Item B, approval of claims submitted for payment process through Tuesday, July 27th, 2021. Is there a motion to approve A and B?
Second.
Motion by Commissioner Maureen Boyle, second by Commissioner Friend. Any questions or comments? Please vote.
Motion passes 5-0.
Next, we have the consent agenda, items A through L. Is there a motion to approve? Is there- Motion by Commissioner Maureen Boyle, seconded by Commissioner Mike Friend. Any questions or comments? Commissioner Maureen Boyle?
Item D, Part 2, the agreement with the Nebraska Department of Health and Human Services Child and Maternal Death Review Team Program, the approval of it through 5/31/2024. As I read through the details of this, the only question I have, and again, it's probably my newness to the board, it seems that we have a relationship with the state to supply staff basically to collect and use this data. So they're not giving us any funding for this. Is this something that's pretty typical? Is this one of those state-funded or one of those unfunded mandates? Or is this just a relationship we have with them to do the right thing? Any thoughts?
I'm not real sure, but we can get back to you on that.
Yeah, I just think it'd be nice to get some funding to pay the salary of the staff that they're asking to do this work. Because it looks like there's a specific nurse being hired, or maybe is already in the position to gather this data.
Okay,
So just a comment, thank you.
all right. Any other questions or comments on the consent agenda? All right, please vote.
Motion passes 5-0.
We'll move to citizen comments. Anyone in the chamber wishing to speak to the Board of Commissioners about an item not on the agenda? Any other questions or comments on the consent agenda? Please vote.
Good morning, Larry Storr, 5015 Lafayette Avenue, Omaha. 68132. I'm going to sum up a little bit this morning because I haven't quite finished my letter to the Douglas County Attorney and the State Attorney General. But I do intend to, primarily for this reason. Even the state constitution in section 1-19, page 4. The right of the people peaceably to assemble, to consult for the common good, and to petition the government or any department thereof shall never be abridged. Now, there's no qualifications to that. It says never. So therefore, your rules are somewhat illegal under our state constitution because it says I cannot address all of you at one time for a particular item unless it's citizen comments and not on the agenda. That denies my right to freely petition my government. I do not have the time, nor do I intend to argue with every one of you privately in your own office or by phone. This is my place, the citizens' place, to do that. But you guys refuse to have a two-way conversation unless you desire it. So therefore, I will be summing that up. And I really want to ask you to help me stop from doing that because I hate to have the city and county and the state spending taxpayer money in order to petition my government. That's not what the Constitution says. You're abridging my rights, my civil rights, my constitutional rights, and the First Amendment. So please consider changing those rules in the very near future. Thank you.
Anyone else wishing to speak to the Board of Commissioners about an item not on the agenda? Seeing none, we will move to presentation. We have our COVID-19 update and COVID-19 vaccination plan update presented by Dr. Lindsay Hughes. Good morning.
Good morning.
Good morning.
I'm Lindsay Hughes, the Director of the Douglas County Health Department. And today, given our discussion around data last week, I thought we would, instead of throwing together slides of numbers, hoping that it would meet your needs, I figured we would go to the work that my very smart and talented epidemiologists and data people are already putting together. And go through that because I think this is going to maybe do a little bit better job of giving you some of the overview that you're looking for. So, that's quite all right. Okay, excellent. All right, so talking about, we'll start with cases since that's just an easier kind of place to start with us, and then we'll go into vaccinations and just a quick overview of our efforts on control of transmission in Douglas County. So this is a quick look at what cases currently are looking like in our community. As you can see, our cases currently are, excuse me, mostly occurring in the young adult age group, but we do have a significant number that are also occurring in the 0 to 19 age group, 14.7. And so we do know that, you know, we are still seeing cases that are occurring in those, more or so that are occurring in those unvaccinated age groups. So that is something that we definitely need to be concerned about. And our rolling averages this gives you an idea of what we're looking at in terms of positive cases per day, and this is a 7-day rolling average. And so right now, what we're looking at is 46.3 positives per day on a 7-day rolling average. So that rate has been slowly going up. As you can see down here, if you look where we're at is, this is updated again daily on the rolling average. You can see where we're on this increase here. Happily, we're not, where we were earlier in the year, where we were quite high, but we are definitely on a trajectory to get there. It is concerning with the Delta variant being our predominant variant right now, because we know that it transmits much easier from person to person than the previous variants did. And so that is something very concerning that we are looking at right now. I also wanted to highlight for you what hospitalizations are looking like for us right now. So right now, we're looking at 79% occupancy rate in our hospitals in the area, which is concerning. Some of you may have seen on the news that the Med Center at UNMC's COVID unit was full over the weekend. All of the people who were vaccinated or who were hospitalized at that time were unvaccinated. And it was quite a struggle from what I heard from my colleagues there at the Med Center to just provide care over the weekend, given how high the census was. We also spoke with some colleagues at CHI Health, and while they were not quite as full, they definitely saw a large uptick in hospitalizations over the weekend. And so, it's definitely something that we're seeing, and that's not surprising given the number of cases that we are seeing an increase. We are also seeing an increase in people who are on ventilators. So currently we have 9 people on ventilators, and that's something that is steadily going up. And we did add 1 death over the past week. So that is something, of course, that we are always keeping an eye on and concerned about. Talking a little bit about vaccinations. We are definitely still continuing to get as many vaccines into the public as we possibly can. So as you can see, we had quite a spike earlier in the year, everybody wanting to get out and get their vaccine. We fell off, and now we're really just trying to get out into the community everywhere possible to actually get that into arms. We continue to go out with our pop-up clinics. So those pop-up clinics, basically we have vans that we can go and stand up a clinic wherever we're needed. We are trying to go to some of the larger festival events, so Millard Days. There are some events like that around the area that we're trying to get into so that we can provide vaccines at those types of events. We're also attending back-to-school events through Omaha Public Schools, Metropolitan Community College, UNO, really just trying to be where we know there might be higher numbers of unvaccinated people that we can catch coming through. Hopefully remove the barrier of them having to travel somewhere else to get the vaccine. It's nice and convenient. We are also working in our other communities in North Omaha and South Omaha to ensure that we are going to be in places that are accessible for our populations there. So I know that we're working with churches, we're working with barbershops, salons, really working closely with leaders within the communities there to help us identify where we would maybe have the best uptake, and trying to be in those locations to make sure that we're able to get those vaccines into the arms that we need to get those vaccines into. Of course, we still worry about those kiddos that are under 12 years old and are unable to get the vaccine yet. So just a very fast update for you on that. At this time, we are not expecting to see the emergency use authorization for that to be approved until sometime in late fall, so probably the October timeframe. Of course, we can always keep our fingers crossed that they move that up a little quicker. And then in terms of the Pfizer vaccine receiving full approval, we're expecting that sometime in January. So we still have a bit of a timeline that we're looking at here. And just, I know, especially Commissioner Kavanaugh, you had some questions about how the data is broken down for vaccines, so I wanted to cover that really quickly for you. Vaccination rates in our community currently, we have 66.6% of our over 18 population is fully vaccinated. If you look at all of our Douglas County residents, which includes those kids who are not even eligible yet, that kind of brings our average down a little bit to 52.7%. And then this is just another little breakdown for you that gives you a little bit better idea in the population how vaccination is going. So here you're seeing with at least one dose. So before we were talking about fully vaccinated, Douglas County residents that are fully vaccinated, 70.3% over 18, which is fantastic. 56.2% out of all of our Douglas County residents. So still have some work to do there. Of course, getting that EUA for the kids is going to be really helpful. You can also see a breakdown by race and ethnicity. So as you can see, we do have some work to do. I will say that there are some things that you need to take into account here. So for instance, with our Black population, that is a very young population in our community. There are a lot of children that are included in that particular population. I think that if you take out the under 18 population, they're actually closer to about 51% vaccinated. But because of just the volume of children that are in that, it kind of pulls that number down a bit. So we're doing a little bit better than it looks like, but we still definitely have work to do there, and that's why we are making sure that we have pop-up clinics and other clinics happening up in the areas where we can reach those populations more effectively. So hopefully that helps to give you an idea of what's happening there. We did put out guidance to the schools this week for how to handle COVID in the upcoming school year. So I know that the superintendents are probably handling a lot of calls from parents today, either supportive or not supportive of how they've chosen to handle that. We'll continue working very closely with them to provide guidance as it changes. I know that a big issue that has been coming up is around masking, and we do, Douglas County Health Department does recommend that children who are unvaccinated be in masks. Especially in light of the variant that is much more transmissible, especially in a congregate setting like a school. That is all I have for you this morning, so I would be happy to take questions.
Commissioner Kavanaugh?
Thank you. Thanks for this, Doctor. Starting off with the mask requirement, it's a request at this point from the health department, right? What do you think about going back to the mask requirement that we had earlier in the pandemic? It seems to be called for under the current conditions with everything going up.
Well, I'm not able to mandate that. That's not a power that my office holds. But, I think that it's something that local governing bodies should consider looking at as, you see the rates increasing. There are a lot of variables that need to be taken into consideration. We have to consider the fact that our healthcare system can only handle so much capacity with hospitalizations around this, and then you start impacting other health conditions. So, if you're full of COVID patients, you can't take care of the heart attacks. You can't take care of the other folks that need care. It's also really hard for people to go to work when they're sick and when they're dealing with the effects of COVID. And so wearing a mask is a really easy way to kind of mitigate that and keep people going to work, keep people going to school. keep society really moving while providing protection both to the wearer and to their neighbors. So it is definitely something that I would recommend considering at this time.
Does the Douglas County Health Department have a mask requirement?
We do not at this time.
On the vaccination front, you probably saw the hospitals, it sounds like the Hospital Association is getting on board with mandatory vaccination of hospital personnel. And that's going across the country. It seems to be that it's endangering our resident population not to have 100% vaccination amongst the hospital and healthcare employees. What's your position on that?
On requiring healthcare personnel to be vaccinated, we require healthcare personnel to be vaccinated in other ways. We require them to have hepatitis B vaccinations. We require them to get flu vaccinations in many, many places. There really is no reason that this shouldn't be different. And I would expect that, especially as, vaccines get that full approval, that more healthcare institutions and even more employers probably will start requiring that.
Is that what you would recommend?
Honestly, yeah, I would.
On the kids' vaccination front, it appears that virtually everybody's going to fall into one of two categories. You're either going to be vaccinated or you're going to get COVID. The kids are exposed at this point, and people who don't wear masks expose them further. They're going to go back to school. Is there a systemic kids mask vaccination policy that the health department is working with the schools on?
So really what we've done is issued consistent guidance, and when I say consistent guidance, it's really coming from Douglas County Health Department, Sarpy-Cass Health Department, and Three Rivers, since we have health, we have school districts that kind of cross lines. And, basically it's up to the school how they want to handle masking versus not masking. So they can choose whether they want to require masks in schools or not. And then how we end up handling cases in the school. So if you end up having,
1 minute.
an outbreak, or you end up having cases of COVID in the classroom, it's really going to end up being handled on a case-by-case basis. So it's really going to be dependent on what's happening in that classroom and the situation in that particular school.
Are you recommending a mask policy, mandatory mask policy for kids returning to school?
We recommend that all children who are unvaccinated be in masks.
And personnel in those schools, teachers and other personnel?
If they're unvaccinated, yes, we would recommend that they wear masks.
Okay. I'm going to come back in my second half here for
Sure.
a couple others. Thank you for this.
Commissioner Maureen Boyle.
Thanks for that presentation. I really liked seeing the data in front of us. It was super helpful. And just a few things, piggybacking a lot on what Commissioner Kavanaugh just talked about. One is the American Academy of Pediatricians and the Centers for Disease Control all recommend masks for kids going back to school. And I think Douglas County, we need to take a really strong stand for that. This is becoming a pandemic of the unvaccinated, and our kids are vulnerable because they don't have a choice of not being vaccinated right now. So even those folks who believe their kids should be don't have that option. So I'm a big proponent of that. Second, as for those in the medical field and mandating it, I'm a big believer in that as well. We do have to take flu shots and have to show a reason why if we don't, or we have to wear a mask if we decline the flu shot. So this would fall in line with something like that, be very consistent with it. So my other concern would really be, I actually feel we should extend that same thing to those in close contact with the public, like the police, like EMTs, fire, our sheriff's department. I'd be curious what our sheriff's vaccination rate is. We already know the city of Omaha, those who protect us aren't protecting us by getting vaccinated. So the only real question I have, to be honest, is I'm completely on board with everything you're talking about. The only question I have is, I know that we're talking about positivity rates. Do you feel like the positivity rate is hard to track now? It might be falsely elevated because we don't have the Test Nebraska site, so we don't have more access to COVID testing?
That is true. However, we are trying to identify currently some additional testing capacity. So that is something we are actively working on. There are a number of places within the community that do test, and there are some that where you can get free testing still. So that's fantastic, especially for our populations that aren't going to be able to afford to go get a test. However, we want that to be more widespread, and we want to be able to, do the typing and the phenotyping and the fingerprinting to make sure we have a good handle on what the virus is doing and what it looks like as it spreads. And so we're definitely exploring other testing capacity in terms of surveillance testing and acute illness testing.
Good. And then just another comment. This feels like we were getting a handle on this, and we're running a race, and then all of a sudden they moved the finish line on us. And I'm getting really concerned that this finish line is going to keep getting pushed farther and farther away from us, because as the Delta variant is out there and people are not getting vaccinated, knowing how contagious this is, one of these days, one of those mutations is going to happen where the vaccine doesn't work anymore. So this could really turn into more badness than we're seeing now, just because people are not getting vaccinated. So I know I'm preaching to the choir, but more than anything, just want to make that comment that since I'm in the medical profession, we see this. It worries me. If you understand the science, this is something that can very easily spin out of control. And it sounds like I'm a doomsdayer, but that's because when you're sitting there watching your patients get sick, it really feels like doomsday sometimes. So I really recommend everybody get vaccinated. It's just not worth it not to.
I appreciate that, and that's why those non-pharmaceutical interventions like mask wearing and distancing and hand washing and staying home when you're sick are also so important, because those buy time for the vaccine to be approved for those younger groups and for more people to become vaccinated, because once you have high vaccination rates, you have fewer people for the virus to get into and mutate. And so that's one of the reasons that we so strongly recommend that people are continuing to follow those, even though at this point everybody's pretty tired of it.
Agree. Great. Well, thank you.
Commissioner Morgan?
Thank you very much for your comments. Is there any information about when those young people under 12 will be able to have a vaccination?
So what we're seeing right now is that they plan to issue the emergency use authorization for that sometime in late fall. So what we're seeing is maybe in the October timeframe.
Okay.
Yeah.
And then on your chart that you showed earlier, on one part of the chart, you showed in Douglas County 692,000 vaccines on an earlier one.
Oh, sure.
And then another one showed 582,000.
Could have
And
been
then I know
one
there was
dose
another one that
versus-
showed the 300 and some thousand. I assume that the 692 means those like myself that had 2 shots would count in that 692.
Yes.
So that'd be not just the number of people, that would be the number of vaccines
Yes.
given. So some of us would be counted twice in that number.
That's correct.
All right, now we move to the 582 after that. Okay, now that one, total doses administered, residents with at least 1 dose of the vaccine. 582,000 in Douglas County.
That's higher than our population, isn't it, sir?
That's what I'm wondering about. So I'm curious, because it looks, and I'm the simple-minded one on the board, that looks like we vaccinated everyone, plus a few others.
It's possible that that number just didn't get updated today, so I'll look into that for you. Thank you for pointing that out.
Okay, I'm sort of a little numbers guy.
I'm glad.
Anyway, then I think there was one other chart you had after that with the 300 and some thousand.
Is that the one right below it?
311.
Maybe that was it, residents. Yeah, okay. But thank you, and glad to see you really digging in here and having it be your home base, and happy you're working here.
Thank you. It's a fantastic place to be, and I am very grateful for my very talented staff that are maintaining all of this every day. I will ask about that 582 number, though.
And I appreciate your smile all the time.
Thank you. Any other questions or comments from commissioners? Commissioner Kavanaugh?
Yes, on the dashboard, I don't know that we looked at it, but I'm looking under vaccinations, and you have an actual zip code map of Douglas County.
We might. Let me look here. There you go.
That looks like it.
This is for one dose.
Mine's in blue, but I don't know if that's just a filter.
How's that?
Percent of residents fully vaccinated.
Fully vaccinated?
Yeah.
Mhm.
So obviously, there is a huge disparity between the western part of the county and essentially North Omaha and South Omaha. And under this, it shows that lowest category of fully vaccinated people, and it says 35 to 40.5%. Does that mean that that's where they are, or it's below 35 to 40.5%?
It would be between 35 and 40.8% if they're in that the lightest color there. If it was below 35%, they would have another color indicated for that. So you can pretty much know that if they're in that really light, I'm going to call it a light gray.
Yeah, right, right.
That they're at least over that 35% mark, or at that 35% mark,
Okay.
but under the 40.8.
So, I mean, off from the 52, or is it, yeah, 52.7% fully vaccinated county average by, 12 to 20%. Huge disparity.
Mhm.
What, if anything, can we do about that that's not being done now?
So I think we're doing what we need to be doing, to be honest. It's a matter of getting into the places where people can access, first of all, and also, having conversations with the people who can encourage those people to get vaccinated. So, if you have people who are still feeling hesitant or distrustful, having their personal physicians or other trusted people in the community talk about getting vaccinated. So there are people other than myself who are going to be trusted to deliver that message. And so talking with them and having them deliver these messages, and then just being available.
Okay. So is there a way to correlate these areas, which are under-vaccinated, and the spike in cases that we're starting to experience? Are they coming from these areas? Can we find out?
We can sure look and see. I don't know that it'll be an exact correlation. Let me see here. So the hard thing to say here, so this is cumulative. So, I mean, for sure, we've seen a lot of cases, but so the hard thing is vaccinations have only been happening since January, late December, January. The case maps that we have encompass the entire pandemic. So it's a little bit hard to make that correlation. So I would interpret that with caution. But
So these positive cases that we're getting, I think that, was it 8+% positive that we're now experiencing?
It's just a hair over 7
Okay.
positivity rate.
It's possible to find out where those people are.
Sure.
right? And that's a contemporary number, that's a now number. Could we correlate that with these zip codes so we can see if they're coming from the same areas where we have this massive under-vaccination?
1 minute.
Yeah, I'm not sure. I mean, I think we can dig that out. I'm not sure how they're currently displaying that. I can certainly ask about it, though.
It's really troubling that we have two areas of our county that seem to be way, way behind the rest of the county in terms of vaccination. And any ideas that you may see around the country, we talked about this before, for incentivizing or requiring vaccinations would be helpful going forward.
So my understanding is, so yes, incentives have worked somewhat in some places. My understanding is here in town, we do have some health systems that have been offering some incentives, and they haven't been real widely taken up on, I guess you could say, which I don't know if that's a matter of the kind of incentive that's being offered. It's just not something that people want necessarily. But for whatever reason, it's not spurring the kind of response that you would hope for.
Time.
It's certainly something that we could look at, though.
Thank you.
The age, the one person who passed away, unfortunately, what was the age? Do
You
we
know, I am not sure. I
Okay.
can find that out and let you know, though.
And then are we still, as we go around with the pop-up clinics and have our own clinic on Fridays, are we offering all of the vaccines, or is it just one particular one?
So at the walk-in clinic at our health department, we offer all three, and people can choose whichever one they want. For our pop-up clinics, we're offering Pfizer and the J&J vaccine. So if they prefer to only get the one dose, we have that available for people.
And then as far as the Delta variant with our positive cases, is there a way to begin to chart that it is the Delta variant versus the other?
Yes, and we have that. It's just not on our dashboard
Okay.
per se. And the caveat that we have there is that we don't phenotype every single positive test.
Right.
So it's only maybe a little less than a quarter of all of the tests that get run. And so, it's just a sliver. But of the ones that we have typed, they have recently all been Delta.
The Delta. And then of those, again, you said those in the hospital are unvaccinated versus vaccinated. Are we keeping track of that piece of it so we have the good data? Because I get comments made that all the cases are people who are vaccinated, so why do you keep pushing the vaccination? Well, that's not true.
Correct.
And so is there a way that our messaging can have those numbers, I guess, in that, like UNMC's unit being full, are all of those unvaccinated folks in that unit, that type of thing. Again, the more correct information we get, I think the better. Some are going to ignore it.
Sure.
Some aren't going to care what they say, but again, if we just have that somewhere for us to rely on, that would be good.
That's a really good point. And I know that we do put some level of that out with our daily press releases. I don't know that it's with the hospitalizations. It might just be when we get a death
In general,
certificate.
right.
We do find out, we can basically look up a person's vaccination status when we're doing an investigation. So we do have a way to make that connection. It may not be like a daily thing because it would be kind of an unwieldy process to make those data connections. It would be great if we just had one data system that just magically pulled it all and put it all in
together.
one place.
That's
It would be
right.
wonderful instead of having 4 or 5. But it is something that we could certainly look at doing. And the comment about Med Center being full and them all being unvaccinated, that was information given to us by our colleagues there.
Okay, all right. Well, thank you, and I just want to give kudos. I mean, it's discouraging to see that we still are low in some of the populations, but it's not for the act of not trying. There has been amazing effort done to get folks vaccinated across this county, and unfortunately, some are choosing to ignore it and just not do it. So it's not for lack of trying on the part of the health department and some of our healthcare providers. So I appreciate the efforts that you've given in that arena.
We're going
And
to
we'll
keep
continue.
pushing.
That's right, we'll continue. All right, any other questions from commissioners? If not, the general public, any questions or comments? Dan?
Thank you, Commissioner Borgeson. I was talking to Dr. Hughes a little bit before the meeting started, and so I just have some folks in my life who, well, it's funny, they masked. They take COVID seriously, but the hesitancy and distrust of the vaccine is so great that I've come up with things to say to them. I've tried recently with the Delta variant to be like, hey, seems to be a lot more serious than before, and that's not working. I just didn't know if your department or colleagues, doctors that you know have had maybe new talking points recently that seem to be convincing some of those who have been unconvinced, getting them to change their mind. I just didn't know if you had anything to share.
You know, we have some really talented people in our department who are able to have those one-on-one conversations with people, and it really is about hearing what their concerns are and speaking to those specific concerns. So sometimes it's about that mRNA piece. You know, people are very concerned when they hear anything that has to do with genetics. You know, that's scary. And so reassuring that, you know, this is not something that can even enter the nucleus of your cell where your DNA lives. This is something that operates outside the nucleus. It's something that, you know, it doesn't even stick around long. It basically comes in, does its work, and then your body kind of just absorbs it. You know, this particular, the mRNA technology has been used in cancer treatments for some time. Successfully, it's been used in other medical technologies. They've just kind of taken it out and moved it over here. You know, sometimes it's about other factors that they have concerns about. You know, sometimes it's not necessarily that. It's about fertility. It's about is it going to do some other bad thing to my body? And really what it comes down to is having an empathetic listener who's able to hear those concerns and then speak to those concerns, and not be pushy and nasty about it, but to just really empathize. And as a personal aside, before the vaccine came out, I was nervous. I'm a parent. I'm a healthcare provider. I was nervous about this vaccine, and I did not know how I was going to feel about it. I didn't know how I was going to feel about my staff needing to have it, and I really did a lot of research. I listened to people who are a lot smarter than I am when it comes to the science, and by doing that and being able to kind of just talk about my concerns with other medical providers, you know, I was able to then come to a place where I felt really comfortable with it, and of course got it myself. My oldest child is fully vaccinated, and it's a process for people to come to the place where they're comfortable getting vaccinated, and it's just important that we listen with empathy and then just talk them through whatever it is that they have concerns about. And if you need talking points, you email me, and I have probably talking points for every concern out there. Yep. You bet.
Thank you. Commissioner Friend?
Thank you, Madam Chair. Dr. Hughes, thanks for the information. I just wanted to add a little anecdote. I had COVID last November, and I also have the luxury of back in 1983, 84, and 85, one of my college roommates who was irresponsible, crazy, did all kinds of fun things. He's now a cardiologist at the Cleveland Clinic. So I trust him because of our past and because of where he is now. I wouldn't say I'm anti-vax. I'm not. I've had jobs where I've been forced to actually have a flu shot. But it's easy for me to communicate to people after I got that information that this is good. A Pfizer shot, a Johnson & Johnson, Moderna, we're good to go. I had about a 25-minute conversation with him, and I grilled him. And he says, he goes, you're out of your element. He said, you need to stay in your lane. And I go, well, what's my lane? And he said, get the shots. He goes, just do it. So what I'm telling you, Mr. Clerk, and anybody else who's willing to listen, don't, the medical community can help. I mean, everybody's got a doctor, or at least they've communicated with one. talk to them about it. They're not going to steer you in the wrong direction. Communication's key. You can't, so anyway, I digress. All I'm saying is, after I got COVID, I was not going to get the vaccine. I'm like, I'm just going to run wild. And when I talked to Ted, he said, no, you do it, you're fine. So these anecdotes can help, and that type of communication, if we're ignoring the medical community and we're not engaged, we're going to have 48, 49, 50% vaccination rates. What we will do when we get that communication, if I'm totally wrong, tell me, is that those rates are going to go up. We'll never get to 100, but those rates are going to go up to 60, 70, 80. I mean, people will be more comfortable. So that's all I really have on it. I mean, I wasn't going to do it. So.
Yeah, I appreciate that. Thank you.
All right, with that, any other questions or comments from anyone? Ben Salazar, you're on mute, sir.
Hi, Mr. Salazar.
Ben, you're on, there we go.
Can you hear me okay?
Yep,
Yes.
good morning.
Good morning all. Dr. Hughes, good morning.
Good morning.
Boy, there's a lot of in this conversation that I could comment on, but first and foremost, as trying to be objective as I can as a listener, and what I've heard are struggles because from Mr. Kavanaugh and Ms. Boyle in particular, pointing out some of the concerns and questions that still remain in my head as a community representative, really, for the health department. There's no clarity in my mind on schools and the kids that are going to be going back to school, because this is a sort of a push-pull situation, and a lot of different players. There's a lot of chiefs at the top making decisions for the community and especially for the kids. So I don't see any collaboration or unanimity of thought on whether the kids will or won't wear masks, and how that system, if you can call it a system, is going to be implemented in the schools. If the decision is up to every school and every school board, I think as a community, we're still in dire straits with this pandemic, because as some of you folks have already pointed out, unless everybody is engaged in this war, there's going to be holes, like the Battle of the Bulge. We're up against the Battle of the Bulge now. So I know there's politics at play. I have seen that the last year and a half, that the medical profession and science dictates really what I rely on. I believe in it. But there's politics at play here, and I know I can hear it, that not only with the commissioners, but with Dr. Hughes and the health department, they have to trod carefully, because they don't want to start to get engaged in the political realm. But really, that's what we're facing here as constituents, as community members, as we have science and doctors saying one thing and politics at play on the other hand. So I don't necessarily point the finger of culpability on my constituents and the people that I work for in South Omaha, for example, because they're giving too many conflicting messages. There's still no unanimity of thought here on masks and even to some extent on vaccinations. And we hear it even here. And so unless everybody is engaged at the top, and I don't know, I don't have the answers as how the leaders can engage politically and medically at the top so that the message is clear and the dictates and mandates are clear. Because that's why we're struggling as a community, because there remains this confusion and lack of collaboration, which I know is difficult. I understand it from the community perspective, because you've got a lot of different players at the top with their own opinions, some based on science, and some, in my mind, completely, out of whack. So I know the difficulties, but really I'm trying to be objective about my own observations, but that's what I see. So like I said, many of our constituents are getting these conflicting messages, and the kids consequently will get conflicting messages because they're old enough, many of them, to understand what's going on. And while I respect the fact that, the schools are going to decide for their kids, for their families. But how are they going to decide that? I mean, do they have a system in place where they're going to say, check Johnny and Angeline for your shot records when you come in or before you come into the schools? And if you don't have them, are we going to force you out of the school?
1
Because
minute.
why? I mean, it's just a ball of confusion still. It's unfortunate. That's all I'm saying. It's unfortunate.
Thank you, Ben. Any other questions or comments on this item? Again, I thank you, Dr. Hughes, for being here, and it is a lot of information, and I still stick by the good work that you've done. We do have work to do, but we're getting there, and you have our support, so thank you.
We will keep wading through the mud together.
That's right, that's right. Thank you. Next, we have a public hearing. This was a public hearing that was extended from last board meeting to be held regarding the advisability of the proposed issuance by the county of one or more series of industrial development revenue bonds on behalf of Creighton University. I don't think there's anybody here today for this, is there? I have to close.
Oh, Teresa York, County Attorney's Office. I did speak with Josh Meyer of KUTEC, and he thought he might join virtually, but I don't see him on virtually. If there's a question, I'll certainly try to answer it. This is 2 conduit issuances for bonds for Creighton University. They came and presented last time the board met and answered questions at that time. One is a refinance, and one is for a new project. And so today we'll do the public hearing and then close the public hearing, and then should the board feel so inclined to go ahead and pass both resolutions approving those conduit issuances.
Okay. This is the public hearing. Is there anyone wishing to speak on this issue? Seeing none, I will close the public hearing.
I make a motion to approve it, and there is not.
Any liability as far as the county.
Right. Okay. Is there a second? Commissioner Morgan made the motion. Commissioner Maureen Boyle seconded it. Please vote.
Sorry, commissioners, we're having a little technical difficulties, it seems. Okay. There we go. Okay, motion passes 5-0.
All right. Next, we'll move to our committees. Nothing really but reports from the Finance Committee as presented. Committee on, which item do you want to speak on? The budget report? Okay.
So just to correct the record, the Omaha World Herald reported after our passage of the budget last week that we had also set the mill levy. That's incorrect. And I don't see the World Herald here. I don't think they come to our meetings anymore. I'm just pointing out that we have not set the mill levy for Douglas County, and that report in the Omaha World Herald was incorrect.
Thank you. Next is the Human Resources. Again, just the weekly personnel report from Civil Service as presented. No legislative items. We do have a need for an executive session. Legal advice, litigation.
Yep.
Okay, is there a motion to go into executive session? Motion by Commissioner Morgan, seconded by Commissioner Maureen Boyle. Please vote. Litigation and legal advice.
Motion passes 5-0.
Recording stopped.
this microphone on.
You have it typed
If you,
in.
yeah, you can totally vote there if you. And Commissioner Kavanaugh, you're a yes? Yes, okay. All right, motion passes. All those commissioners present voting yes?